Hi, my name is Adam White. I'm a physical therapist at Duke. I see primarily orthopedic patients. Most of them are joint related, spine related. I also work with a specialty population that is an amputee population. So for patients that have undergone limb loss, I do amputee care training, gait training for that population as well. What got me into physical therapy was a desire to work in a medical field. I was always very interested in kind of the physics behind the body, biomechanics, kinesiology. One of the reasons that I like to work with the amputee population is because you really see that taken to an extreme. Not only are you dealing with the physics and the mechanics behind the body and its natural joints, but then you've got these applied mechanical parts that you also have to take into account for. So you're dealing with not only the physics of the body, but also the physics of the prosthesis that the patient's wearing. The first time I meet a patient, the initial evaluation is really about getting an understanding of what the patient's going through, understanding where they're at. So we do a lot of baseline measurements. We do a lot of special testing to try to understand or to really narrow down what's going on and what's causing the issues that they're having. We also start to try to develop an idea of the personality of the patient that we're dealing with. So understanding what's going to fit into their lifestyle as far as treatment, so we can really tailor a treatment program to that individual. I think Duke does a very good job of trying to make its employees feel like it's part of a family versus just an employee at a big institution. And that carries over to the patients as well. So if the employees are treated well, they're respected, and they feel very comfortable where they're working, I think that they tend to pass that feeling on to the patients. So we try to bring the patients in and not think of them as, oh, this is my 10 o'clock appointment, but this is, Mr. Smith, and he's here for this reason, and, I want to help him just like I would a family member.